Welcome to Understanding Human Anatomy. In this video, I'm going to begin a discussion of the gluteal region. And you can see from the screen that I've sketched in already the bones of the area. We have the sacrum, and a little more than half the sacrum, and then the right os coxae and the proximal end of the right femur. I want to start by sketching in some ligaments. And the first two we've actually talked about in other videos, principally the videos on the perineum. And one of these ligaments is the sacrotuberous ligament, which I'm sketching in right now. And that basically bridges over the space between the sacrum os coxae and the open area inferior, turning this into one large foramen. And we have the greater sciatic notch and the lesser sciatic notch and the ischial spine. The other ligament is the sacrospinous ligament, which runs between the sacrum and the ischial spine. This then converts the greater sciatic notch into a greater sciatic foramen and the lesser sciatic notch into a lesser sciatic foramen. Next, I want to look at a couple of ligaments in the hip joint. These are the ligaments that hold the hip joint together. There are three of them. We can see two in the posterior view. The first one here is running from the ilium over to the femur. And this is the iliofemoral ligament. And I will fill that in here. Like so. The second ligament comes from the ischium, and it is the ischiofemoral ligament. I'm sketching in here. And again, I'll fill in the ligament. So these are the ligaments we're going to see in this area. We have the sacrospinous ligament, here, the sacrotuberous ligament, there. And again, those ligaments convert the lesser sciatic notch into the lesser sciatic foramen. here, and the greater sciatic notch into the greater sciatic foramen. And then we have the iliofemoral ligament, here, and the ischiofemoral ligament, and that is this ligament. And I should add that there's one more ligament around the joint that we can't see, the pubofemoral ligament. We'll look at that when we look at the anterior side. And one ligament that runs through the acetabulum. It runs from the center of the acetabulum right to the head of the femur. And this is called the round ligament. Or the ligament of the head of the femur. And this ligament is not really a structural ligament. It is a method for the body to bring blood supply to the head of the femur. One last ligament here is the ligament between the sacrum and the ilium on the posterior side. And this is the posterior sacroiliac ligament. And I will color that ligament in as I did the other ligaments, like so. And it's a ligament, one of the two ligaments that hold the sacrum and ilium together. So this is the posterior sacroiliac ligament. right here. So those are the ligaments that we're going to look at. And before I continue with the muscles, I'm going to erase all the labels from the ligaments so that we have room to draw in the muscles. Now, the first muscle I'm going to draw into the diagram is the piriformis muscle. And piriformis takes origin from the anterior surface of the sacrum. So it takes origin on the inside of the pelvic cavity. It then passes out through the greater sciatic foramen to come over and attach to the greater trochanter of the femur. So this is the piriformis muscle. And we'll color it in here. So, piriformis. Now the piriformis muscle is a key muscle of the gluteal region. It's a key to understanding it. So let me put the label on here. Piriformis muscle. Right here. And what we're going to find is that the piriformis muscle takes up most of the greater sciatic foramen, but there are structures that enter the region superior to the muscle and inferior to the muscle. And we're going to find that there is a nerve, an artery, and a vein entering the area through the greater sciatic notch, but superior to piriformis, and another nerve, artery, and vein lying inferior to piriformis. Now the nerve, artery, and vein lying superior to piriformis are the superior gluteal nerve, artery, and vein. And the ones entering inferior to piriformis are the inferior gluteal nerve, artery, and vein. And as we'll see in a short while, the sciatic nerve also enters inferior to piriformis, at least most of the time. So here we have the piriformis muscle, which is the key muscle to the area, and the superior gluteal nerve artery and vein and the inferior gluteal nerve artery and vein. The nerve artery and vein being the superior gluteal nerve artery and vein entering the region superior to piriformis, and the inferior gluteal nerve artery and vein entering inferior to piriformis. The superior gluteal nerve will be supplying gluteus medius and minimus. The inferior gluteal nerve will be supplying gluteus maximus. That will conclude this video, and I'll pick up with this diagram in the next video and continue our discussion of the muscles and the sciatic nerve running through the area. Thank you for your attention.